Leading things off, our first guest is a social justice advocate and life coach. Joins us for a look at mental health and the impacts in minority communities. We welcome Asha Tarry to the show. Welcome, welcome, welcome. I asked her, I said, are you ready? She said, I'm more than ready.
That's right.
All right.
Good
so
morning.
Tell us about how you started it and how you got into it and all of that stuff.
I've actually been a social justice advocate for about 20 years.
All right.
Doing work in communities around the country, and
Yes.
then I went to grad school for social work, and about 4 years ago opened up my own private practice as a psychotherapist and life coach.
All right. Now, it says that you worked with Gary Bird or was interviewed by Gary Bird? Who's on
No, possibly in the past we were interviewed on the same show together.
There you go.
Yeah.
Okay, yeah, that's my man Gary. Of course, he's on WBLS and WLIB with us. So who do you serve? What communities do you serve?
So mostly I serve the Latino and African American communities, but my work is very broad. So adults 18 and over who have either chronic or severe mental issues, including mental health disorders.
Yeah.
So it can range from anything like anxiety, which is a growing epidemic in our community, to depression, to trauma. Intergenerational trauma is a big part of what we work with.
And some of the mental health issues that you deal with, do people easily come to you or you have to seek them out or?
No, so these are functioning adults, people who are working, sometimes working and going to school, raising families. So most people find me through reaching out on different websites, or social media is a big way that we market our services as well. So these are people who want to be in treatment. They're voluntarily active in their own treatment.
And of course, as you well know, there's a big stigma attached to
Absolutely.
Mental health, and some people don't want to step up to the plate and maybe realize that they do have a problem or situation. How do you help them with that?
Well, again, people are coming to me voluntarily. It's different when you're coming to me involuntarily and someone is forcing you into treatment.
Yeah.
But when you're coming on your own because you see issues arise in your personal relationships or work, or it's affecting multiple areas of your life at one time, people understand that there's reasons for that, but they don't quite know what the root cause of it is. So when we talk about stigma, especially when it comes to minority communities, we talk about the issues around historical stigma and how that has played an impact in people not seeking out treatment over time. But what we try to do is work with people where they are. So we look at it as a way to develop and cope with different things that may have been maladaptive over time, and understanding that mental health is something we all deal with. Mental illness is when it's chronic and it's something that has been affecting them over a course of time. So most people are dealing with psychological issues as it pertains to stress, medical issues, intergenerational trauma. So we're uncovering all of those things, and we're taking the stigma out of it by working with the root cause of what's happening.
Something snaps them out of it, you know, and they come to you or come to people like you. When should one step up to the plate and say, hey, I have a problem and I need help?
Good question. When you find that your coping tools are no longer working. So if you're doing things like smoking, drinking to cope with sadness or loss or emptiness, when you find yourself overeating or lashing out at people, raging out, when you find yourself losing job after job, losing friends and relationships, then you know that there's something going on that you need to seek professional help for.
And you've been blaming everyone else, but now it's time to take a look at yourself.
Be accountable.
Yeah. So what do you do upon finding that this person has this problem? What's the first thing, the first step that they need to know?
Well, number one, we look at it as an environmental, social, and psychological issue, not just something that stemmed from what the person may have lacked growing up, like parental issues that have affected them long term, or different ways in which their family modeled coping. And especially for our communities of color, we have had a long history of suffering, but we don't acknowledge it publicly. We think that part of our life and upbringing is inclusive of suffering. So we talk about that, and we talk about
a lot of people think it's normal.
They think that it's normal. They think that it's a part of their culture to suffer. So we take that into context and we put it into the environment, and we look at the social systems that impact people's lives as well. Not just your psychology as it pertains to you as an individual, but how the community is impacted by it and how you're impacting the community.
Yeah. Wow.
Yeah.
So you go deep.
It's deep.
Yeah. So you go deep so you can draw out all this, you can find that there's problems along the way, and you can help put those or mend those problems or help heal those problems?
Well, definitely help heal those problems, but from a culturally relevant perspective, we definitely talk about race and ethnicity. We talk about the ways in which our society impacts people with traumatic experience, especially from the diaspora. So we make it very contextual to what the people are coming in for. And a lot of my clients are people of the diaspora, so Latinos, African Americans, Africans, first-generation immigrant families, but also people from other communities too. But we look at the context in which the person is coming from versus the person outside of the environment. They are part of their environment. And what does that part of being in their environment play in their lives and how they cope with racism or sexism or misogyny? How does that affect their relationships, the way they deal with other people at work or at home or in their communities? So it's very sociological as well as psychological too.
And this is a broad spectrum. Do they come with you, do they come to you for like specific problems? Does it stand out more so than anything else in our communities?
I think we haven't dealt with it properly because we've been affected by all the stigma associated with seeking out professional help. But yes, they do.
What do they come to you mostly for?
They'll ask me things about if dealing with poor relationships is normal, dealing with dysfunctional families and how that's impacted the way that they think of themselves, their self-esteem, how it's been impacting the way they relate to other people. Microaggressions is a big part of their working in communities and corporations and in nonprofits and how that's impacted the way that they get along with other people. So a lot of times it's about dealing with racing thoughts, not being able to turn those thoughts off, feeling overwhelmed easily, stressed by work and life in general, having a lot of different roles in which they play but not being able to manage them all effectively. So we have those different issues that come up repeatedly in my clients' cases.
And how does physical and mental health come together?
Well, your mental health is part of your overall health. So if you're physically impacted by something that's going on with you mentally, it's going to have an interplay. We find that most people of color also deal with chronic medical conditions associated with mental illness. So a lot of times we'll see people who are depressed who might have hypertension or chronic asthma. We'll see people who have all kinds of stress-related ailments, including physical pain in their body.
Chronic asthma is a part of mental health?
Definitely. Can be. It's correlated. Yes, absolutely. We have a lot of poor children who live in environments that are impoverished that are facing these kind of generational issues of being, you know, exposed to different chemicals in their environment and having asthma very early in life and having difficulty sometimes being able to breathe is also a symptom of something psychological.
Right, so what do you want people to know about, of course, July is Minority Mental Health Awareness Month.
Yes. So we deal with Mental Health Awareness Month in May, but we focus specifically on people of color in the month of July. So we want people to know that, number one, your mental health is a part of your overall health. And there's nothing to be ashamed of when you seek out help. It's for you to be able to learn different ways of coping, to understand that mental health is something that we all are facing, but mental illness can be prevented. So seek out the help that you need.
And where do they go to seek out that help?
So they can go to my website, which is lifecoachasha.com, and they can also reach out to me on social media. So I'm on Instagram and Twitter under Asha Tarry.
I like that, lifecoachasha.com. Okay.
And then they can go to Twitter and find me and Instagram as well.
.com. Twitter and Instagram too?
Yes.
Okay.
All right.
Is there anything you want to say to my camera here? I have a little friend. Sometimes he needs help, you know, and
being able to gel people. We want people to seek out the help that they need. That's most important.
That's most important. Period.
Period.
All right. And give me the website one more time.
So lifecoachasha.com.
Asha Tarry, give her a big round of applause, everybody. Life coach and social justice advocate. All right, Asha, we're going to take a quick break, but I promise we'll come back with a whole lot more.